Hey, Mr. Francis. My name's Emmy. I'm a student at Texas State, studying to become a family nurse practitioner, and I'll be taking care of you today. What brings you to the office?
I haven't had a primary care physician since I was a kid, since my pediatrician. So I'm just coming in for a checkup and to kind of make sure I'm not going to die randomly.
Good. Well, we will get that taken care of. How old would you say you were when you had your last checkup?
Probably 18.
Okay. And you're 26 now?
Yes.
Correct. Okay. Do you have any concerns?
I've had some hypertension recently when my wife is checked, just at home with the little cuff. And so I thought I'd get that looked at. My collarbone is also broken from a recent wreck, and so I wanted to make sure there were no complications or secondary effects from that.
Okay, very good. How long ago was that wreck?
6 weeks.
6 weeks. Okay. Are you still hurting?
Not as much. I am occasionally sore after I exert myself. If I go on a long walk or try to stretch in a way that I haven't in the past, then I'll occasionally be sore, but it's not as intense.
That's good. What have you been doing to make the pain better?
Relaxing. I've been stretching. I've also taken ibuprofen and prescription Norco.
All right. Do you remember the dosage for that Norco?
I think it's the 5 milligrams of hydrocodone and 3.5 of acetaminophen.
Okay. And any other medications?
Occasionally I take Zantac for heartburn, just on an as-needed basis. It's not an everyday thing.
All right. And what other ways has your collarbone affected you? Do you have limited range of motion, weakness,
I have
stress?
limited range of motion. I'm a little bit more stressed out because I'm not getting to work out like I usually do, which is one of the ways that I relieve stress and get my head clear. So that's kind of had a blowback effect in that way.
I see. And do you have any allergies?
No.
All right. And no seasonal allergies or anything like that?
Occasionally I'll get stuffed up from the cedar, but nothing really bad.
Okay. And how much caffeine do you typically consume? Coffee, tea?
About 2 cups of coffee a day. It was more like 4 or 5 cups until I tried to cut back recently to counteract the hypertension and calm down a little bit.
Good. Tell me about your use of alcohol.
I occasionally drink, but not over the top, I would say. Maybe 8 drinks a week.
Okay. Do you smoke?
No.
Have you ever smoked? Chronically?
I mean, not chronically. Maybe once in high school.
Okay. What about drug use? Ever used marijuana?
Yes, but not recently.
All right. When was the last time?
Probably 5 years ago.
Okay. Have you ever used cocaine?
No.
Methamphetamines?
No.
Any other drugs for recreational use?
No.
Okay. Now we're just going to talk a little bit about your history. As a child, did you have any chronic illnesses, diabetes, cancer, asthma, immune disorders?
No, not that I'm aware of.
Okay. What about illnesses such as measles, mumps, rubella, whooping cough?
Chicken pox was the only thing I remember. I also had asthma when I was very small,
Okay.
but that's pretty much cleared up.
How old were you when that resolved?
Maybe 8.
Okay. And how old were you when you had the chicken pox?
Probably 6.
All right. Have you had the vaccine?
For the chicken pox? I don't believe so.
As an adult, have you had any chronic illnesses? Besides the possible high blood pressure, things like diabetes, hepatitis, HIV?
Nothing like that.
Have you ever been hospitalized?
Once when I broke my arm, I was hospitalized overnight. for a surgery on my wrist, which involved putting a couple of screws inside, and then I had pins sticking out of the wrist, which were later removed.
Okay. And what year was that?
About 2004, I believe.
Okay. Any other surgeries?
I had my wisdom teeth taken out. I don't know if that counts or not.
Sure. What year was that?
2006, maybe?
All right. Have you ever had any problems with emotional or mental illness?
No.
Okay. Let's talk about your immunizations. Have you had a flu shot this year?
No.
Do you remember when your last flu shot was?
I believe 2006. I was working at a doctor's clinic then, and so I was required to get one.
Okay. Do you know if you've ever had the Tdap vaccine? That's going to be your tetanus, diphtheria, and pertussis, which is the whooping cough.
I have had that. My niece was born 2 years ago, and my sister made all of us get the vaccination before we held her.
That's good. Got to protect the baby. Do you know if you're up to date on your MMR, which is your measles, mumps, and rubella, or your hepatitis B?
I do not know.
Okay. I would assume so. Most of the time you get those as a child before you go to school. So let's talk about your family history a little bit now. I'm going to ask you about your immediate relatives, which include your parents, grandparents, or any siblings.
Okay.
Are your parents alive?
They are.
Okay. And how old are they?
63 and 47. My father's 63, my mother's 47.
Okay. And your grandparents?
Just one. My maternal grandmother.
And how old is she?
72, I believe.
Okay. What about your grandfather?
Maternal?
Mm-hmm.
He died in 2012. He was 74 then.
Okay. And on your paternal side?
My paternal grandfather died in 2002 at 79. My paternal grandmother died in 68 at the age of 42.
And how did they die?
My grandfather had liver failure, I believe, and my grandmother had brain cancer.
And how did your grandfather on the maternal side die?
It was never determined. There was not an autopsy. He died in his sleep.
Okay.
He was overweight and had emphysema. So I think there were a variety of contributing factors.
Right. And do you have any siblings?
One brother,
And how old is he?
28.
All right. And does he have any health issues?
He's also had hypertension and occasional acid reflux.
Okay.
So we both got that going.
Reflux is no fun. Okay, now I'm just going to go through some disorders, and if any of those immediate family members have had them, just let me know.
Okay.
Coronary artery disease?
No.
Okay. Anyone have elevated cholesterol levels?
My father, yes, and probably my grandfather
Okay.
on my mother's side.
Diabetes?
My father and my maternal grandmother.
Okay. Thyroid or kidney disease?
No.
Anyone had a stroke?
My maternal grandmother has had, and I don't remember the technical term, but they call them like mini strokes.
Okay. Arthritis?
My father and my grandmother, maternal grandmother.
Tuberculosis?
No.
Asthma or lung disease? I know you mentioned your grandfather had emphysema. Any other problems?
I think that's it.
Okay. Anyone in the family have recurrent headaches or migraines?
My mother gets migraines, and I occasionally get migraines as well.
Okay. Anyone have seizure disorders?
No.
Mental illness run in the family at all?
No.
Anyone ever tried to commit suicide?
No.
Anyone with substance abuse?
No.
Okay. And what about cancer? I know you said your grandmother had brain cancer. Anyone else in the family ever had Any kind of cancer? Prostate, breast, ovarian, colon?
Yeah.
Okay. Any genetic disorders run in the family? Cystic fibrosis, autism, mental retardation, anything like that?
No.
Okay. Any other illnesses you can think of that we missed?
Nothing I can think of, no, man.
Okay. Now we're just going to talk a little bit more about you. What is your highest level of education?
Master's degree in fine arts.
That's great. And what are you currently doing for a living?
I teach at a university,
Which one?
Texas State.
Well, hey, looky there. And how long have you been doing that?
4.5 years.
Okay. And what is your home situation like?
I have a wife and a dog, and we live in a house.
Okay. Any current concerns there?
No.
Okay. And because sexual practices put people at risks for certain diseases, I ask all of my patients these questions. How many sexual partners have you had in your lifetime?
1.
Okay. And do you have any concerns about HIV infection or AIDS?
No.
Okay. Do you have any spiritual beliefs that you'd like me to be aware of so that we could best take care of you?
Christian.
Okay. And how do you typically deal with stress in your life? I know you mentioned you exercise. Anything else you do?
I read, go on walks, hang out with my dog.
What kind of dog do you have?
Dachshund.
Oh. Okay. And do you use any alternative healthcare measures? Yoga, acupuncture, any herbal supplements?
No, not really. I don't think
Okay. Not on any kind of special diet?
so. I take protein shakes, or I used to when I worked out before the collarbone thing.
Okay. All right. Now it's going to seem like I'm asking you 100 questions back to back, but it's just so we make sure we didn't forget anything, okay? What's your usual weight?
185-ish.
And have you noticed any unusual weight gain or loss recently?
No.
No weakness, fatigue, fever?
No.
Okay. Any problems that you've noticed with your skin? Rashes, lumps, sores, itching?
My skin gets dry in the winter, but that's about the extent of it.
Okay. And have you noticed any changes in the size or color of your moles?
No.
All right. I know you mentioned that you sometimes get headaches. How often would you say those come about?
Maybe once a week, once every couple of weeks, something like that.
Okay. And where do you typically, what area do you feel them? Is it just on the temples, general?
It's general. It hurts to look at things. It hurts to look into the light.
Okay. And what?
And it's usually one eye.
One eye. What normally makes the headaches better?
Sleep, if I can get it. Sometimes eating.
Okay. Any problems with your vision, glasses or contacts that you use?
No.
When was your last eye exam?
Probably 2010.
Okay. How are your ears and your hearing?
Fine.
Any problems with your sinuses, frequent colds?
I've had a couple of colds this winter, but not like long-term problems.
All right. And are you feeling stuffed up or congested at all today?
A little congested, yeah.
Okay. Any problems with your throat, teeth, or gums?
No.
Okay. Have you noticed any swollen glands or lumps in your neck?
My right lymph here behind the ear is a little bit swollen.
And how long has that been going on?
Probably 3 weeks, 2 weeks.
Okay. Any lumps or pain that you've noticed to your chest?
No.
Any problems with your lungs or breathing?
No.
No cough, wheezing, nothing like that? Okay. Any troubles with your heart? I know besides the high blood pressure.
No.
Okay. And you mentioned you had the heartburn. Any other problems with your digestion?
No.
No problems with nausea, diarrhea, constipation?
No.
Haven't had any changes in your appetite recently or problems chewing or swallowing?
No.
Okay. And you haven't noticed any bleeding in your stools?
No.
They've been normal? Okay. Have you had any swelling in your lower extremities? Pain to your calves, cramping, anything like that?
No.
Okay. Any problems urinating, burning, history of urinary tract infection?
No.
Okay. Ever had a hernia or testicular pain or a mass?
No.
All right. No history of sexually transmitted infections?
No.
Good. Any problems with muscle or joint pain? I know you mentioned your collarbone. Do you feel stiff?
A little stiff there, yeah. My left shoulder's pretty stiff, and my left elbow also, and my hips occasionally hurt.
Okay. And have you been doing any specific exercises to help with the range of motion and weakness?
Some stretching and things like that, yeah, but nothing too intense.
Okay. Are you seeing a physical therapist?
No, I'm seeing an orthopedist right now, but I haven't moved into the physical therapy realm yet.
Okay. Do you have any problems with anxiety or depression?
A little anxious maybe, but nothing over the top.
Ever had suicidal thoughts?
No.
Okay. Have you noticed any recent changes in your mood, ability to pay attention, or speech?
No.
Any numbness or tingling to any parts of your body that you've noticed?
No.
No history of seizures, tremors, or involuntary movements?
Nope.
Okay. Almost done, I promise. Have you ever had a blood transfusion?
No.
Any problems with anemia?
No.
Problems bruising easily?
No.
Okay. Any thyroid trouble?
Nope.
All right. Any excessive thirst or hunger, sweating, heat or cold intolerance?
Nope.
Okay. That just about sums it up. We'll be doing a physical exam today in just a little bit, but that's it for now, and I thank you for your time. It was nice to meet you.
And you as well, thank you.